Wonderful. Thank you. Next slide, please. So this is Clement Steinbach, and as I said earlier, I'm the director for the National Quality Center. And this is one of our Partnering Care calls, and we really are very delighted to have 3 presenters today facilitated by Dolores, and we really welcome all of you to this call. It is an important topic. If you look at the statistics around where the infections are coming from, youth is usually one of the top category, and so we really wanted to utilize the opportunity and really focus today. This will be a very interactive call, so please use the chat room and please just speak up. This is really hopefully a very engaging call, and we really respond to your questions. Next slide, please. Thank you. So as you know, this is part of our Learning Exchange, which is a 9-month initiative, which will come to a close next month. And we really want to look at 4 key populations that we identified that we felt there are room for opportunities, and that's MSM of color, transgender people, as well as African American and Latino women. But the one group of focus of today is really about youth, and we really want to use that opportunity to focus and share some of the strategies that have been found successful around the country. Next slide, please. This is just a larger context for the National Quality Center. We're providing a multitude of different levels of technical assistance, reaching all the way from just sharing our improvement resources all the way to building communities of learning, which this Learning Exchange is part of. So we're very excited, and as you know, over 90% of all Ryan White recipients have accessed NQC services, and so we're very happy to be a catalyst for change around the country. So, do you want to kind of turn it over to you, and maybe you want to also introduce yourself, and then I will be on the sidelines, but thanks so much, Dolores, for being the facilitator for the call today.
Thank you. Thank you. So I'm Dolores Dacre, and I am the lead consumer facilitator and lead consumer for in+ Disparities Campaign Learning Exchange. So I'm very happy to welcome everybody to this call. I agree with Clement. It is going to be an opportunity for us to interactively interact with each other and really delve into the issues of youth and really what are some of the solutions to increase youth health outcomes. So for our agenda today, we've done the welcome and introduction, and each presenter, I will ask them to introduce themselves as they begin to speak. We're going to share our stories and look at some of the current common barriers and really kind of what are some of the facilitation to increase care. We're going to talk a little bit about HIV self-management, and hopefully we'll have a vibrant question and answer session. Next slide, please. Our learning objective over the next hour is really to look at 2 ways we can increase the leadership skills of youth to become more engaged in quality work, and then to describe key opportunities to engage youth in clinical quality management activities. Next slide, please. So we're going to start with our story, and our first presenter is Devin Quinn. And Devin, I'm going to ask you to introduce yourself and to tell us a little bit about you, and then to go into your story.
All right. Thanks, Dolores. Hello, everyone. My name is Devin Quinn, and I am a peer navigator at Nationwide Children's Hospital in Columbus, Ohio. I also am a board member with an organization known as Youth Across Borders. It is a nonprofit organization that works to create cross-cultural partnerships with young people living in Ohio to young people living with HIV in an orphanage in rural Honduras. So I've been doing this work since about late 2012. I was diagnosed with HIV in 2012. and I have been kind of steadfastly working, hitting the ground running to do whatever I can to improve the lives of my community members and to kind of put a very open and welcoming and public face on HIV. I work with a lot of different groups and a lot of different communities, and I'm really happy to be here and doing this work. So my story is pretty, in my opinion, it's not really that complicated. I was diagnosed in 2012 after being tested, and my experience getting into care was really more personal barriers than it was actually the barriers of the facilities that I was dealing with. Unfortunately, when I enrolled in care, the one experience that I did have was that I had what seemed to be a revolving door of personnel that helped me transition into care. I wasn't quite sure at any one given point who I was dealing with and what exactly their role was at the time, because when, in my experience, someone is newly diagnosed, it's very hard to process all of the information that's kind of coming at them at once. And so if you're seeing many different faces, it can be challenging to just kind of remember that and who you're dealing with, what their names are, why they're helping you, what they're helping you with. And so I was able to eventually transition my care to a place where I felt that I wasn't dealing with too many people, and that issue of transitioning personnel was no longer a problem. And because of my experiences with that, in our clinic specifically, I was able to take that experience and adapt it into a measure where when a patient comes in, they receive a sheet. It's called a clinic sheet, and it has the names of the providers that they will be seeing that day. And once the provider sees that patient, they have to sign off that patient's sheet to acknowledge that they did indeed see them for that appointment visit, and then that sheet is handed back to the receptionist at the end of the appointment to kind of complete this loop of who you've seen and why you've seen them, to kind of put a face to the name and create a more identifiable experience for the client. So using my experience as a patient with my kind of confusion and adapting that in a QI method, and so far we've had really great success with patients knowing who people are, because one of my first experiences working in a clinic setting was a patient thought after I was done seeing them as a peer navigator that I was a doctor. And at no point did I express that I was a medical physician in any way, nor would I want anyone to think that I was. So it's helpful for that aspect. It's also helpful for the provider aspect, so they know who needs to see whom, and patients don't linger in rooms for too long.
Excellent point. And you've mentioned kind of one of the challenges to achieving optimal health outcomes for young people. What are some of the other challenges that you would like to address? So some of the really big challenges that you see faced by youth in achieving optimal health outcomes.
Well, I think there is just a lot of different points on this board that we keep trying to tackle. I think, we keep asking ourselves, what do we have to do to get people in care? What do we have to do to maintain people in care? And I don't think there is really one good answer. I think that honestly it has to come down to an approach of individual care for individual clinics, and that is really not something everybody wants to hear, because ideally you'd like a fix that works for everybody, right? I think for youth in particular, to get people engaged in care and to get people to really hear the message, that actually has to come from almost a federal level, where we need more comprehensive healthy relationship, not just healthy sex ed, but healthy relationship education. And unfortunately, given our current political climate, I think it's not likely that that's going to happen anytime soon. So engaging with youth on, I think, almost a peer level, where you can have either targeted social media or targeted outreach services to the communities that directly need it, where you have honest face-to-face encounters with people who are from the community experiencing the same difficulties that they're experiencing. And so it doesn't look like someone from not outside your community is coming in and telling you how to do things or why you should be doing things, just identifying with a person on a person-to-person level. And I think that would help engage that. And I know it's kind of vague and it doesn't really kind of cinch that knot really well, but unfortunately I think it has to be done on a community-by-community basis and understanding what your demographics are and who you're trying to reach, because your message that you're trying to target for your community group is not going to be the same for every demographic, and I think that's really important that we remember that everybody has differences and uniquenesses that make care a very widely complex thing to deal with.
So are there any organized ways that consumers can organize to care and to look out for others? You talk a lot about peer involvement. So maybe we could explore a little more how peer could be an opportunity for us and kind of explore a little bit more about that, if you can.
Yeah, well, I think we get into kind of a catch-22 with this whole problem, like I said earlier. So we are the most connected generation that we've ever seen on the face of the planet, and we're also the most isolated because of those connections. So people are treating their care as an individualistic process. So when I go in and talk to a client as a peer navigator and say, here, I'm going to be your support person, I'm going to work with you if you have any questions, do you want my help, kind of, spiel, a lot of the times I'm turned down because people believe that this is something they have to handle on their own. And they don't believe that that support is a necessary component, which unfortunately I think we can all pretty well say is a very necessary component dealing with most any kind of experience in life. Support is important. And so in order to reach people, I think we have to be very aggressive about how we talk to them. And I think what I mean by that is we do sometimes, I think we have a really bad habit in society of labeling generations in whatever way we see fit. And so in terms of like Generation Millennial and Generation Z, we're already getting a lot of labels of lazy, entitled, and uninterested, when in fact the research goes completely opposite of that fact. These generations are incredibly engaged, incredibly self-aware, incredibly driven, and so meeting them where they're at and also acknowledging their experiences. So in terms of talking to peer groups, I think the National Quality Center recently did a training where they were teaching consumers how to understand QI data, and I was a part of that, and I thought that was a really fascinating approach to get consumers involved in understanding the complexities of understanding data, because a lot of times in community groups and community meetings, Ryan White meetings, a lot of data by professionals is thrown on the table, and people are just expected to go along with those decisions and understand it. Unfortunately, those decisions are sometimes made with best intentions, but not the best interest of the client at heart. And with clients can understand that information, then they can be better equipped to help the care process. So making sure that, A, we're hiring people who are HIV positive and also people of color to make sure that everyone is well represented. Because, I personally work in an organization where I am one of 2 people who are HIV positive, and we are on the rather low rung of the decision-making process, and that sometimes can be a little disheartening. And so if we're hiring people who look like us, have our experiences, then our care will reflect those results. And I think that's what's really important.
Thank you so much, Devin. Our next speaker will be Noelle Smith.
Hi, Doris.
Hi, how you doing?
Oh, good. Oh, good.
So I'm going to ask you to introduce yourself and to tell us where you're from.
Yeah, so my name is Noelle Smith, and I'm originally from Argentina. I have been living with HIV for 11-plus years at this point. I currently live in Charlottesville, Virginia, and here I am working at UVA Ryan White Clinic at the university. and I'm leading a peer coach program that teaches consumers to be leaders in their own community, to be able to learn, develop their professional skills, and really help other consumers that they're struggling with different barriers to care when they're trying to engage in their HIV self-management. So basically, that's me. Soon I will be moving to New York to be engaged in HIV research, behavioral research. So those will be my next steps. So, but currently, with our peer coach program that I have been working really hard to really run the pilot project and really make it really a service that we can provide to all our community members that are really wanting to help other people living with HIV and giving them the tools to be able to do that. But when we're talking about youth in particular, sometimes we have like some challenges. And I can reflect back on that on my own when I was very young when I was diagnosed back in 2004, and I can remember that the challenges for myself at that point were really stigma and literacy about HIV. So I think it's still being, after 11 plus years, still being a very big challenge for youth to really deal with the stigma that we're still having in our society about HIV, about mental health, but really to really understand how we can overcome stigma and fight for our cause, we have to really learn about HIV, to be really like spread the word and really reach out to other people and teach them about HIV and and how is the struggle for us, and make them understand that. So that's kind of a little bit of myself, Dolores.
Thank you. So when you think of the program that you're currently involved in, what are some of the biggest opportunities that you've seen to help youth achieve optimal health outcome? I know you touch on one of the barriers as being stigma. How do you address that issue in your program, or any other issue that arises that you see as a challenge?
So challenges, stigma and literacy are two of the bigger ones that I can think of. But really, some different challenges, thinking about youth specifically. I think there's like challenges about like successful engaging in self-management of the chronic condition. Is one of the challenges. Also, to have enough information about resources in HIV prevention or education, to have better knowledge when are facing thematic situations, which oftentimes those situations really create mental barriers for youth to be truthful about the HIV care, about their HIV status, denial, and also creates a lot of fear of being marked or tagged and discriminated because of the health condition, resulting oftentimes in, I can think of, I don't know, I don't want to know, or as long as I feel good, I'm good. So that is things that if we really think about challenges, as oftentimes is what I hear from youth, that they really don't want to know if they feel okay, it's fine. But educating youth about being positive or being negative, just to encourage them to really know their status. If you're positive or negative, it doesn't matter, just to know your status. I think that's one of the challenges that youth in this times had.
So there's a good here. There's a good question here that even expounds on what you've been saying, and the author is asking you, do you work with clients one-on-one or in groups to bring out leadership qualities?
So our program, at the current stage, we're a clinical service that we address clients and one-on-one conversations. Coaches really are trained with motivational interviewing skills and all the different skills as well that we consider are important to really being able to get the most valuable information from the conversations with our clients, and really understand and being able to mentor them into a good self-management and understanding of their condition and how they can manage it the best they can. We don't do quality. I mean, we do some quality work, but it's more programmatic. Than anything else. We provide more a clinical service for our clients one-on-one. But we are looking into the near future to be able to not have just one-on-one conversations with our clients, but also increase the visibility of people living with HIV in our clinic setting, where we are going to be trying to address the stigma that in our community is a very big issue, to bring it more to the normal stage.
Thank you. You know, you mentioned self-management more than one time, and I think it's so important, self-management. And I want you to kind of help us to understand some of the concrete steps that you try to convey to youth as you deliver self-management intervention.
So some steps that I will say when we're working with youth and encourage them for self-management and for taking care of themselves. It's really, I encourage all the people that I work with and the peer coaches there in the front lines meeting with patients. I encourage them to really help them to establish a daily routine to facilitate the medication management, for example. I think that to have those routines, create those routines sometimes is a very big challenge for people that are not thinking about this chronic illness, that it has to be really understood and really well managed. So establish a daily routine will be something that I encourage consumers to really think about. And also to encourage them to have an open communication with the healthcare provider. And share all the details about their health and behaviors, so they can really have a full knowledge of the big picture and able to assist them better in understanding where they're at and how they can get what they want to get, talking about their health.
Excellent. Thank you.
You're welcome.
So I'm going to open it up for questions. And remember that you can put questions in the chat box. And ask any of our presenters. But Partner in+care is an initiative of NQC, and what it does is it really looks at different levels of involvement and engagement that people living with HIV can become involved with. And I'm going to go back to our presenters and really explore with them when you look at the Partner in+ structure, kind of where do you see yourself? And I want to start with Devin. how do you really engage, or what are the actions you take to mobilize your community or to increase engagement?
I do two things. I try and stay as visible as possible in terms of what I'm doing, when I'm doing it, how I'm doing it, whether that's just kind of talking to community groups or showing up at public meetings or always having a presence. I also practice the acronym WAIT, W-A-I-T, which means to me, why am I talking? Because a lot of the times it's really easy when you feel left out of a conversation and you've been presented with an opportunity to say something to dominate that conversation and never get any point across. And so I think it's really important to listen and listen intently. And so I facilitate a support group, and so when I'm in that role, I help to convey these same attitudes to the clients I'm working with by taking kind of a more recessed role and stepping back. And I do that in order to make sure everybody feels that they have a place at the table and they can get their piece across, but it also it allows me to process and really focus a conversation that's important so I can really get the important details. I think using social media is an incredibly powerful point that I don't use personally enough. I'm kind of old school in terms of how I communicate with people, and I lack sometimes the best ways to get a hold of people using social media, which I think is a really helpful tool for engagement. And I also just I try to build bridges where I can. So in our community here in Columbus, sometimes there can be a little bit of animosity between agencies for some reason. I've never quite understand. I'm sure a lot of people are familiar with turf wars between agencies for funding and resources and demographics and whatever. I don't believe in that. I think it's silly. I think it's downright dumb. And so I work directly with people in other agencies when I can, where I can, and how I can to accomplish a goal. If there's, we're working on a project and I think that this person from this agency is going to be helpful because they have some knowledge base they can bring to us, and they have some free time and they want to help, let's get them on board. Not isolating ourselves and feeling that we all have to do this agency by agency, but we can do this community by community.
Excellent point. Excellent point. So I noticed that there are some questions coming up in the chat box. If you're on mute, there is a little symbol beside your name, and you can unmute yourself and ask questions. I don't know if Christine would like to unmute herself and ask the presenters the question that you have in the chat box around technology and its use in engaging youth in care.
So this is Noelle. I think the question is, what is my experience in using technology to engage youth in care? So I would like to share about a project that we grew in our clinic setting that's called Positive Links. That is it's a phone app that helps consumers, mainly youth, but it's open to any ages, to really engage in self-management of the chronic illness and really have a better understanding and increase the communication between consumers in an anonymous way. So we take out of the picture the our socioeconomic level or our race or any other barriers that will possibly in person will be preventing us from engaging in a conversation with someone. But in this app, we have been very successful in enrolling our clients. And the young ones, the younger ones that are enrolled in this app, they seem to really like it, to use the app because it really is integrated with the same technology that they use every day, that they have in their pocket. So it has been really a really good tool to engage youth, to share content as well. We have a link inside the app that is to share resources and informational videos about stress management and about different topics related to HIV. That whenever you're interested in just like you're browsing on Facebook to see through news, you can browse in the app and just increase your knowledge about different topics related to HIV. So we have this knowledge base there that is always at your fingertips in this app. And in addition to that, this app also increases the self-management of the chronic condition by monitoring your stress level daily, your medication intake, and also gives you all your appointments that you have, at least in our health system. Not only our infectious disease clinic, it's for the whole system. So that really helps our clients to really get to where they have to get in the system and see their doctors and plan a little bit better for their day, and really, if they're stressed, they can talk with other people and anonymously and say like, hey, this is what is going through in my head today, and just hear other people that might have a different input or a different way to see those situations. That reduces oftentimes reduces the stress.
Wow, thank you. It seems like technology is really playing a more central role in how we engage and work with youth. One other question came from Diana, and she's saying, outside of stigma, do you believe that some issues that keep youth out of care consist of social issues? And some of these social issues are like housing, insurance, youth working on the street, not being able to eat or have a roof over their head. What are some of these social issues that you encounter in the work that you do with youth?
Personally, I mean, I see this all the time. So if we're talking about Maslow's hierarchy of needs, then, you know, someone is not going to be able to access care if they can't prioritize that care in their life. So if you're going day to day trying to figure out a place to sleep, it might not be, you know, pertinent to you to figure out when your next medical visit for 3 months is, or, you know, if you can't get to the pharmacy to get your meds, you're not really going to worry about that because you're just trying to get food in your stomach. So when I see people, when our social workers see people, we really try to do a really engaged assessment to figure out where they're at in those needs, and so we can break them down on kind of an acuity level, so we can figure out what their needs are most, and where can we most focus the important attention that they need in that moment. So we're not just kind of blanket coding everybody and, you know, not really getting to the issues that are important. And while we can't handhold everybody through every situation and resolve everybody's problems, you know, like, you know, with a magic wand, we can maybe link them with resources and talk them through problems and use motivational interviewing to kind of figure out what the crux of the problem is, what's going on, how we get there. It's really important to meet the person where they're at and understand that, you know, if a person actually does come into their appointment and they identify that they are homeless and they are experiencing food shortages, you know, and that they haven't taken their medicine for however long, it's important that we recognize that is just a human being who's going through a really tough time, and we cannot just keep emphasizing this, well, you have to take your medicine, because that message is just going to fall on deaf ears. And we have to really make sure that we say, okay, well, what can we do to help make sure that we facilitate that you have a safe and secure, stable place to stay? Or here's some resources about, you know, local food pantries. If we can make sure that they have that stability there, then they can begin to really prioritize their own health. And for some of us, that's hard to digest because it's contrary to what we might want to say. We might want to say, well, if you're not healthy, then how can you look for housing, or how can you look for a job, or whatever? But that's just not how a lot of people prioritize their lives, and we have to understand that and be really humble to that fact that we sometimes have to help clients make decisions that we might not feel are the best for them in the moment, but might be best for them in the long run.
Thank you. Thank you. That is so true. And that is really have been true of just really treating people with HIV, is that we have to provide support services that really help and maintain them in medical care. I have some follow-up questions for you, Noelle. People wanted to know where is Positive Link available? Is it available to the general public? Is it available nationwide? Is it an app that, you know, people could download and use, or is it just related to where you are?
So that is a yes and no answer. So Puzzle Links is an app and that we already are using it as a preferred in our clinic setting as a usual care. So it's a service, another service that we provide in our clinic. Other agencies are if they're interested in having it in their setting, they can reach out and they can look at the link that I just posted there. That is the official link for Puzzle Links. The app for the phone is not available on the App Store or Google Play because it's a project that has to be brought to the actual clinic setting of CBO to build the capacity in your organization to have the people who is going to be supporting your the app for your clients. Because it's tailored to the clinic, to the CBO that is going to be using that app. So that's why I say it's a yes or no, because it's available, but it's not in the App Store. It has to be brought to your clinic, and you have to have your team of people for Puzzle Links, and then you will install, and your team will install that app in all the consumers' phones. The project that is currently funded through VDA, the Virginia Department of Health, in Part B, currently is basically we provide to our consumers with, or anyone that wants to really enroll in the Puzzle Links app, that is a patient in our clinic. We have a meeting with them. There is a 15-minute enrollment period, and in that enrollment period, we assess if the consumer has a phone or doesn't have a phone. If it doesn't have a phone, we provide them with a smartphone, and we also, upon completion of the when they're enrolling, we provide them with also a refill card for their phone service, so the service will be active and they will have a phone number that they can be reached to. Upon the first month of use, we assess if the consumer is utilizing the app, and through different questions they're going to be receiving every day. I think there are like 3 questions. It's like, do you take your meds today? What is your stress level? And I think there is one more that I cannot remember. Give me just a second. The stress level and your mood. That is integrated with the electronic medical record. So your doctor, when you're going to your visits, is more aware of like how you're feeling, and they can have a little bit of a background on how you're feeling that day, and can be ready to help you a little bit better.
Thank you.
So
that's
yeah,
great.
so if they answer this
what
question,
I want to know, can people follow up with you? I see the website on the note page, www.positivelinkforric.com, but can folks follow up with you to get more information on this app?
So I'm not coordinating this program. Locally, that is where the app was developed. That's our agency. They can contact, I'm going to put it now there, Ethan Jones, that is our coordinator for Puzzle Links app. So I'm going to put his contact information, and you can contact him there, and he will be able to provide you with more information and help. But currently our team is helping other agencies to implement Puzzle Links and do it quickly, since we already know how to, like the needs that have to be met for this project to be successful then.
Thank you so much. So
You're welcome.
there are some more questions in the box, but again, I'm going to encourage folks to just unmute yourself and ask questions. But a lot of the questions in the box are around engagement and how really the steps we need to take to really engage. So one question from Kate is, for youth who are more complacent with their care, the I don't want to know, I feel fine, young people, how do you engage them? How do you motivate them to self-advocate for their health? And I really like the idea and the discussion around positive link, because that seems to be a way to keep folks engaged. But is there any other methods that you want to add to that discussion around engagement and really helping young people to self-advocate for their health?
I think for me personally, with this experience, I've had this experience with clients where they say, you know, I'm fine, I'm okay, I don't need anything, I'm good. And sometimes I can kind of tell there's something more going on there. And this is where it gets tricky for people, because I think we have to balance, you know, how much social support we can provide. I mean, sometimes you can only see a patient for, 15 minutes at a time, and you don't have everybody available. And this is why I try to push, if available, for people to have, for programs to have peer support, because then I get the opportunity to get to know the patient. If I can get to know the patient, and, you know, I'm asking them these general questions about HIV, and I can say, you know, I'm fine, I don't need to talk about it. All right, well, what else is going on in life? What do you do for fun? Who are you as a person? And if I can open that gap a little bit, when someone feels comfortable enough with me talking to them, then they might, in some way, kind of roundabout get to more issues that are more pressing around HIV. It's kind of a circular conversation, and it can take time, and that is where it gets difficult, is because we're more socially isolated. Even though we're more connected, we're less willing to open up to people, especially strangers. I mean, we're coming from a generation where it's completely acceptable, and nor is it actually expected. If I send a text to someone I'm interested in, maybe even a stranger, I should be okay with accepting absolutely no response back. We can't do that in real life, and we're socializing a whole generation to be able to accept that non-responses are okay, which then contributes to a lack of empathy and a lack of self-encouragement. So people don't want to talk about these things. It's a psychological component that contributes to a much larger problem. So you have to get to know the patient and meet them where they're at, and then maybe you might be able to get that. It's not an easy answer, and it's incredibly complicated.
Yeah, I agree. And I mean, even when we continue to talk about engagement, our definition of engagement might be very different from a young person's definition of engagement. There's one question here from Liz that wants to know, you know, do you have any best practices or strategy for including young people in HIV planning bodies that include various age groups, and to keep them engaged and to ensure that their voices are being heard? But, you know, I also think that, you know, do young people think that planning groups are the way to go? So I'd love to hear a little bit about your experience. You know, I'm older. I've been a part of the planning council for a long time, and I think that's a vital place for your voices to be heard around the issues that impact your access. But are young people thinking about that? I want to hear more about that.
Personally, I mean, in my experience, I want to freely admit that my experience, I hope, is not indicative of the greater norm. But my experience was joining the Orion White Planning Council when it was first formed here in Columbus as one of the 33% of positive people on the council. And what I experienced was not a pleasant thing. I was the youngest person on the planning council. The other people who were HIV positive were much older and much more experienced, but also had very specific goals in mind that were really personal, instead of thinking on kind of a macro level of what we needed as a community. I also, as a young person, didn't have any skills at the time or understanding of data. Excuse me, I didn't understand a lot of the program components. I definitely at the time did not understand anything about Ryan White. I was just a layperson kind of thrown onto this and just expected to vote yes, no, or, you know, not sure, because they just needed to comprise the council of 33% positive people. And I think in order to engage people or youth to be interested in that, we have to, A, publicize these things and make sure they are recognizably important. They're comprised of working professionals who've been doing this work for a long time, and, you know, everybody's asking this question, why are youth not showing up? Well, I didn't know about this until the right person told me, and after that, it was kind of just, you know, go on, do your own thing, and learn from listening, and that was not helpful. I needed guided information. I needed someone to explain to me, what is data, what does this look like, what is Ryan White, and I had to do a lot of that on my own. So, you know, mentoring clients and turning them into those kind of ambassadors, which can then, you know, then put them on the council, even give them a special designation, you know, because sometimes titles do help with participation, you know, making them feel included so that, you know, they're not just a token on that board, or that they want to be a part of something. Because there are people out there, I get questions all the time about how to do my job. You know, there are people who want to participate. I just don't think we're engaging them in that conversation of, these are the ways you can participate. We see our advocates being very public and very open, and, you know, it's great to have a social media following and to be a famous speaker, but the work that needs to be done is really nitty-gritty, and, you know, reading spreadsheets and charts. It's not a sexy topic, and it's not easy to get people to really be excited about that. So if you maybe foster that connection with your client and find somebody who's really has that talent and that skill that you think would be suited for that, really just facilitating that relationship until they can work with that and then eventually graduate to that role.
Excellent point, excellent point. And Noelle, I wasn't sure if you wanted to add to that comment. I was noting your head, so I wondered if you had something to add.
I'm just really agreeing with Devin. Keith just said everything in that topic. I think, yeah, I mean, identifying people that have those skills, I think, is really important, but also the people that has the skills to do that nitty-gritty work that is very specific, also to have the capacity to build the capacity in future generations, in younger people, to interest them in doing that work, because it's like pass it on. And that would be my addition to that, just to pass that knowledge to other people.
Thank you so much. So, you know, there's a question here from Debbie, and it really is addressing some of the other issues that might constitute a barrier for young people, and it's how do you approach the issue of disclosure with youth? And what are their biggest challenges with respect to disclosure with family members, intimate partners, and what support do you think youth need or youth request to deal with disclosure?
I mean, with disclosure, basically, for youth, we try to start talking about the topic and just like really like knowing what is in their head and what they are imagining it might happen, or what they define the people that they want to disclose to, and why they want to do that to that specific people. I think it's very important to understand the why and who before we are considering to go ahead and disclose, because you might be thinking, oh, I want to tell this and this friend just because I think we're closer friends, but it might not be the correct person to say it. It might hurt in the future because we're not like really strong at this point. I think opening the conversation about disclosure and just brainstorming with another peer that might feel more confident about disclosure, or even thinking about your community health worker or case manager in your clinic setting, to really bring out the disclosure topic to see if it's possible to, if you want to disclose to someone that it means a lot to you, but you need that encouragement, that safe space to have the possibility to bring these people that you want to disclose to a safe space to you to be able to share that with that person, and to have the support of a professional or someone very knowledgeable about HIV and other related topics to really fill in this person with the correct information in case they have a lot of questions that the person maybe because being very emotional or not really having enough knowledge, they cannot respond to those questions to the person being disclosed.
Excellent points, excellent point. You don't have to disclose to everybody, but you do need to disclose in order to get the support that you need. Yes, I totally agree. And, you know, at every stage, it really does seem that mentoring and getting a peer to kind of guide you along these issues is very supportive and helpful. I want to thank both of you for a really inspiring discussion. You brought a wealth of knowledge, and I want to all the responses in the chat and in the whiteboard will be shared with you in an email. I am going to turn over this discussion now to Emily to close out our webinar. So Emily, next slide, please.
Yes. Hi, everyone. Thanks so much for such a lively discussion. So just to close things out, some follow-ups, I will share all the information that I took down as notes on the whiteboard, as well as the chat transcript. And earlier, someone asked for the client data, the clinic sheet that Devin was talking about, so that will also be sent out too. And just like a little reminder of what's coming up, so this is actually our last month of population-specific events. So starting in May, we're going to be focusing on sustaining our gains moving forward. So it's going to be a lot of discussion of sustainability of efforts, how you keep improving your interventions, looking at what's been accomplished. So there's a lot of exciting events coming up. The next event that we have is actually next Friday. It's going to be a special office hours as a journal club about PDSA cycles and improvement. And we will also be having our usual webinar on the third Thursday of May, as well as the last Thursday, which is going to be our Partners in Care on May 25th. So yeah, please always refer to the website if you have any questions or would like to see the full calendar. And also feel free to contact me or any of our speakers if you have any further questions. Once again, thanks so much for your participation today.
Thank you so much.
Thank you so much for Dolores and Noelle and Devin for doing such a wonderful job. And with that, I will end the recording.
Thank